Episode 3, Tracking Illness, Morbidity and Surveillance Explained. Hey there, welcome back to EpiDecoded, where we explore the science of public health, one meaningful concept at a time. I'm Dr. Aurora, and today, we're going to talk about something that sits at the very heart of epidemiology, tracking illness, or, to put it more formally, morbidity and disease surveillance. Now, I know morbidity and surveillance sound like intimidating terms, but trust me, by the end of this episode, they'll make complete sense. And not only that, you'll start noticing how these concepts show up all around you, in the news, in healthcare decisions, even in your day-to-day life. Let's start with morbidity. It's a simple word that means something pretty big, illness, any departure from health. So if someone has the flu, that's morbidity. If someone's diagnosed with diabetes or asthma or a broken hip, those are all morbid conditions. Now, morbidity isn't just about one person getting sick. In epidemiology, we ask, how much illness is out there in a population? How many people are affected? And when did it happen? And to answer that, we use two key measures, incidence and prevalence. So let's break those down. Incidence is the number of new cases of a disease that occur in a specific period of time, say, 1 year, in a defined population. Think of it as the flow of new illness entering the population. If 5 people in your neighborhood are newly diagnosed with COVID-19 this week, that's incidence. Prevalence, on the other hand, includes all cases, both new and existing, at a particular point in time, kind of like a snapshot. So if 10 people in that same neighborhood currently have COVID, whether they got it this week or 2 weeks ago, that's prevalence. The key difference is time. Incidence measures risk, how likely someone is to develop the disease. Prevalence shows us the burden, how much of the population is currently affected. Here's a quick way to remember it. Incidence equals new cases, prevalence equals all cases. And yes, they're related. A disease with high incidence but short duration, like the common colds, may have low prevalence because people recover quickly. But a disease with lower incidence and long duration, like diabetes, can have high prevalence because people live with it for years. So why does this matter? Because when public health officials want to allocate resources, like how many hospital beds are needed, or how much medication to stock, or which communities need urgent attention, they turn to these numbers. And that brings us to surveillance. In everyday language, surveillance might sound like something out of a spy movie. But in epidemiology, it's one of the most important and powerful tools we have. Surveillance is the ongoing, systematic collection, analysis, and interpretation of health data. It's how we track trends, identify outbreaks, and detect emerging threats, all in real time. Think about it. During the COVID-19 pandemic, how did we know cases were rising? How did we monitor hospitalizations, or variants, or the effectiveness of the vaccine? Surveillance. We rely on hospitals, labs, clinics, schools, even Google searches to feed into national and global health surveillance systems. The Centers for Disease Control and Prevention, the CDC, runs multiple surveillance systems. So does the World Health Organization. They monitor things like flu season, cancer registries, foodborne outbreaks, and yes, novel viruses. And just like a weather radar gives us early warning for storms, epidemiologic surveillance gives us early warning for disease. When done right, it allows us to act before a crisis spirals out of control. But surveillance isn't just about catching big dramatic events, it also shows us long-term patterns, like whether obesity is rising in certain age groups, or how often people are getting screened for cervical cancer, or whether asthma is more common in urban versus rural settings. This is how we detect disparities, inequities, and emerging needs. Let me tell you a story. In 1981, U.S. health officials noticed something strange. A handful of previously healthy young men were showing up in hospitals with a rare type of pneumonia. Then other unusual infections appeared, these scattered cases, tracked by CDC's passive surveillance system. were the first clues in what would become the global HIV/AIDS epidemic. Surveillance doesn't always make headlines, but time and time again, it's the early alert system that saves lives. Now, there are two main types of surveillance: passive and active. Passive surveillance is when health facilities report data voluntarily, like submitting case numbers to the health department. It's cheap and efficient, but it can miss things, especially if reporting is inconsistent. Active surveillance is more intense. It involves outreach, calling hospitals, checking records, maybe even going into the field. It's more accurate, but also more expensive and time-consuming. During an outbreak or investigation, we might switch from passive to active surveillance to get a clearer picture. There's also something called sentinel surveillance, where select, high-quality sites are used to monitor trends, almost like health sentinels posted around the country. It's a cost-effective way to keep a pulse on what's happening. At the end of the day, morbidity and surveillance help us answer three fundamental questions in public health. What's happening, to whom, and what should we do about it? It's not just about counting cases. It's about understanding the bigger picture, about using data to shape decisions, improve care, and protect people. So the next time you see a graph on disease trends, or hear a news report about rising cases, remember, behind those numbers are real people. Behind those numbers is surveillance, and behind those numbers is a science working hard, often quietly, to make sense of it all. That's it for this episode of EpiDecoded. If you learned something today, I'd love for you to share this episode with a friend, subscribe, and maybe even leave a review. It really helps this little podcast grow. Next time, we'll explore mortality, not just how we measure death, but what those numbers really mean for public health and policy. Until then, stay curious, stay informed, and stay well.